Okay, so tell us a little bit of how everything got going.
Certainly. I started with waking up one day feeling like I was underwater for my hearing, and I'd had a little bit of vertigo happening over about the 3 months before. And so I made an appointment thinking I had a sinus infection, and from that point had a hearing test and an MRI and found out that I had an acoustic neuroma. And so I was referred to Dr. Hahn and came and talked to him about my options, as well as I talked to another physician about gamma knife radiation. So I did some homework before, and then from that point I decided that I wanted to go ahead and have the surgery procedure and have the tumor removed. I felt that that was the best option for me with the limited loss of hearing that could happen, as well as growth that could continue to happen if I didn't remove it. So that was my choice at that point in time. And go ahead.
And when you made that choice, you then went forward with the surgery. How long ago was your surgery?
3 weeks today was my surgery date, and I had it here at Medical City with Dr. Hahn and Dr. Como.
Okay. And how was the recovery? Tell us a little bit about the recovery period for you.
The recovery has been very successful, I believe. I was in ICU for a little bit and then moved to a regular room, and then I was home within 5 days from the day of entering the hospital to leaving the hospital. I went home. My first week at home was fine. My second week I experienced pain. My second week for about 4 or 5 days that it was pretty bad in the afternoon time is usually when I would find it. That was the first time I used the pain pills other than when I was in ICU. So I felt that that was really good, and have just stuck with Tylenol if I've had a little headache or anything. I did the eye exercises several times a day. I walked and did the spotting exercises, and I think that helped a lot for me to recover and feel better.
And the balance, how has that been for you since the surgery with the removal of the tumor?
My balance has been much better. I think walking a lot helps with the balance issue. And then I did kind of spotting exercises that PT showed me while I was here at the hospital, which I think also helped as I walked with my balance. I still have a little bit of dizziness, but usually that's in the shower when I'm kind of moving my head around, to wash my hair or do anything. But other than that, I'm not having other dizziness.
Great. And so have you had a positive experience with the tumor resection and the surgery and all that?
Yes, I'm very pleased with the experience, because it's never fun to hear that you have a tumor, whether it's benign or not, and so that was a scary situation. But I feel like the experience was really good in the sense of everything was explained to me very well, and I felt that I had sufficient knowledge going into it.